It's very common in veterinary medicine for us to, I can't think of a better word than poo-poo client complaints about dogs and cats that are aging as normal aging. And yes, the body, as part of the aging process, starts to change and in ways that we don't all love. But that doesn't mean that we need to surrender to those clinical signs. Of course, aging gracefully is not the same thing as aging prematurely because of a cognitive disease, and that's really what cognitive dysfunction is. There's a crossover in the land of cognitive dysfunction between what a veterinary neurologist does and what a veterinary behaviorist does. It's a time when veterinary neurologists often have to play behaviorist or refer to a behaviorist, and it's a time when veterinary behaviorists also play neurologist and pain management doctor in order to make sure that we're covering the medical basis of this disease process. So don't think of it as a behavior problem in as much as the clinical signs are behavioral symptoms of an underlying disease process, just like lethargy is a behavioral symptom of an underlying disease process. The prevalence of cognitive dysfunction, and we're going to focus mostly on dogs and cats, is actually higher than one might expect. For those of you out there who have had lots of aging animals, it actually might ring true for you. But in dogs, we're looking at almost 30% of dogs that are 11 to 12 years of age having at least one clinical sign of cognitive issues. And for those dogs that are 15 to 16 years old, almost 70%. And in the case of cats, we're looking at possible cognitive signs in patients that are 10 to 11 years old, even around 50% of those in that species. So it's an important thing to recognize that it's actually really common, and for those of you that are veterinarians in the audience, it's well worth screening for. In our practice, we start screening and proactively supplementing, changing diets, doing treatment plans to attempt prevention starting at no later than age 7. And that number is because there are some studies that indicate that lab beagles may actually be showing some problems in their cognitive status as early as 6 to 8 years. So that's when we're going to dive in to make sure that we can do the best we can to prevent progression. So the other things we're going to talk about are the clinical signs of this disorder, prevention strategies. Unfortunately, there's not a lot of clear science on that at this point. Diagnosis, supportive care and cognitive hospice, and quality of life considerations and euthanasia.